I'm going to talk about COVID and variants because one is in the news and I'm getting questions like, do I need to wear a mask again? And I think it's really important to contextualize this. So, SARS-CoV-2, the cause of COVID-19, is a endemic respiratory virus. It's going to be with us in perpetuity. And like all respiratory viruses, it's going to try and evolve to get around immunity in the population, immunity that's built up from prior infections, immunity that's built up from vaccinations and combinations of those two. So we're always going to have one variant coming up, one variant coming down, and that's going to go on basically forever. The key thing is that we have a lot of immunity that protects us against severe disease, hospitalization, and death in most people, not necessarily in the high risk. And for those people, we have vaccines, we have monoclonal antibodies, we have antivirals. So, what's happened now is that the virus has been kind of the Omicron version of this virus for some time, for several years. And we've got different branches of the Omicron family that dominate. And over the last week or so, we've heard a report about a new variant called BA.3.2, or sometimes called cicada, because it kind of was something that was dormant for a while and then became prominent or more prominent. And that's because BA.3.2 evolved from BA.3, which was one of the kind of swarm of early Omicron variants and basically went away for some time and was circulating at a low level, developed more mutations that have now allowed it to rise more into prominence, accounting for maybe 30% of cases in Germany. And these mutations allow it to get around some of the immunity that we have. But some of the mutations make it bind less to our cells. So it's unclear where this is going to land, although it is something that is being found in the United States, but only in 0.1.9% of sequences. But it is in wastewater in many different states, so it's something to watch. The key thing, though, is that, is that this variant may pose problems for vaccine strain selection. And they've already met in December, the WHO, and they picked a strain called LP.8.1, which is not likely to do so well against this BA.3.2. They're meeting again in May to see whether or not they need to make any differences or changes, but obviously the companies will need lead time. And these vaccines are very important for high risk people. Now, this is not a new variant. It's been around at least since November of 2024. What's new is the CDC put out some data about its prevalence in the United States. It doesn't have any new symptoms. And for people asking me, do they need to wear a mask? That all depends on your risk perception, your risk tolerance. Again, this is not a very common variant in the United States, and we've got a lot of immunity that protects us against severe disease. But for high risk people, I always think that when you're in crowded, congregated places, it may make sense to wear a mask if you choose to wear a mask. And that's each person's individual decision. But this is not a scariant.